All right, it is 3 o'clock. I know it is election day, so we're hoping to give you guys something else to focus on other than the election. So welcome everybody that's joining us. Again, thank you for joining us today. Today we're going to be hearing from Claire Mosby. She's the prevention coordinator of the Utah Domestic Violence Coalition. Emily and I have worked really closely with her, so we're very excited today to hear her talk about communication, mandatory reporting, and talking with your patients about this. And these are our 5 primary prevention areas. These are the goals we've been working on. We're doing institutional policies, prevention, mandating reporting, how to talk to your patients about the mandating reporting, things like that. And then next month, we'll focus on resources available at local, state, and national levels. None of us have any disclosures to let you know of. For nurse contact hours, you just have to make sure that you are participating in the final polling question. Social work CEU hours, you will also get granted 1 hour. The difference is that you will be emailed 3 knowledge check questions. So make sure you watch for that email. Claire will be with us again on November 17th, where we will also have breakout rooms, getting more in depth about these reportings and conversations with your patients. And then in December, we'll look at resources. And December 15th, we're hoping to get a panel presentation across the board of local Department of Health workers that can give everybody different resources available in their area. We have our trauma ground rounds, which is this month on the 19th. EMS ground rounds, we don't have one this month. We have one next month. They're always the second Wednesday of every month from 2 to 3 p.m. It will be on environmental injuries by Annette Matherly, our burn educator. I'm going to turn the time over to Claire, let her introduce herself and give you guys a little bit of background and get started on our presentation. Thanks, everybody.
So my name is Claire Mosby. I work with the Utah Domestic Violence Coalition. I'm joining you today to talk about intimate partner violence, or IPV, and reporting and intervening, and what your role is as healthcare providers and practitioners in whatever space and capacity you fill. I work across the state. Normally, I would be out and about facilitating trainings and implementing programs that would be working with community members and domestic violence service providers around the state, but we're still able to do these programs just from home. I would love to hear from you as much as you're willing and comfortable. If you have anything you'd like to say, please unmute yourself and chime in. Plan for us is recognizing the circumstances when healthcare providers must report IPV injuries to officials in Utah. So this is mandatory reporting, right? And what do you have to include in those reports, right? I want you to be able to comfortably discuss mandatory reporting laws and options with your patients. And also the other side of that, what can you do within your office or in your units, in your clinics, practices to incorporate prevention-focused skill building with your patients or your organization? Because we're not just reacting to injury and assault, but also building prevention into what we're doing and into the work that you're engaging with patients across the board. I've looked at the beautiful past trainings through this series. They cover intimate partner violence and sexual violence, so I am not going to do that. But just in case you haven't attended those sessions or would want just a quick second refresher on it, when I'm talking about intimate partner violence today, here's what I'm referring to overall, right? A pattern of abusive behavior in any relationship that's used by one partner to gain or maintain power and control over another. I think Dr. Kathy Franchuk and Kristen Hall did fantastic jobs really explaining the dynamics of intimate partner violence and sexual assault and how healthcare providers see that and what that really presents as and how you all would see that in practice. And if you didn't attend those or haven't seen that, I encourage you to check out those YouTube videos to get that in-depth explanation. But for now, right, we're talking about current or former consensual romantic partners of some nature. So that's dating partners, spouses, sexual partners, right? This is these are not strangers in nature, right? There's that romantic element there, right? Where there was at one point, at least at one point, a consensual element there. The abuse includes elements of physical violence or assault, sexual violence, stalking, psychological or emotional aggression, very broadly. And then when I say sexual violence, right? So sexual violence occurs within intimate partner relationships, but it also occurs without intimate partner violence, right? Sexual assault can occur with strangers or coworkers, friends, and there's never been a consensual romantic relationship. So there's that differentiation, okay? Very brief rundown, but we're talking about intimate partner violence by and large. Now, as we shift into sort of our next focus for healthcare providers, I want to know, do you think for your work, if you're a mandatory reporter, right? We're going to talk about mandatory reporting for your job or your position. By the end of this, my goal for myself, Claire objectives would be I would like it for you all to know 100% if you're a mandatory reporter or not. See, 60% of you said, yes, I am a mandatory reporter. 10% said, nope, I'm not. And 30% of you said, I'm not sure. All of those are just fine ways to respond. Thank you. So let's look at Utah. But when I say mandatory reporting, what is mandatory reporting even? Like, do we know what that means? Do we know what you're being asked to do? If I say you are a mandatory reporter, those of you who said no, or I don't know if I'm a mandatory reporter, also could have said, Claire, I don't even know what that is, so lay off. And that's fair, that's okay. So mandatory reporter is generally someone who's legally required to ensure that a report is made to an official, right, when you observe abuse of some sort, to abuse of a person who is required to be reported by. So in Utah, and this is part of our code, right? Every adult citizen in Utah, so adult 18 plus, has to report child abuse. So child 18 plus. So every adult citizen in Utah has to report to DCFS or law enforcement if you suspect that a child might be a victim of abuse, neglect, or exploitation, right? The child doesn't necessarily have to have an injury for adults to report. So to easily answer that, like our question right off the bat, yep, are you an adult in Utah? I don't know, does everyone live in Utah here? Maybe, no. If you don't, and your state is different, your answer might be different. But if you're an adult and you live in Utah, yes, you are a mandatory reporter. So your answer might already be changed from our last poll. Another category where every adult citizen in Utah reports is for vulnerable adults and for vulnerable adult abuse. And that means people who are 65 and older or 18 and older, and if there are mental or physical impairments that substantially affect abilities for independence. And if you are interested in the specifics of that, I'm happy to share what that code and what those definitions are. But it's the same guidelines as child abuse. If a vulnerable adult's been abused, neglected, or exploited, that's a reason to report. And it doesn't require an injury to report. It's just that suspicion of abuse, neglect, or exploitation. And we report to Adult Protective Services or law enforcement. So every adult in Utah reports child abuse and vulnerable adult abuse. Now, that's for everyone in Utah. We're talking, you all, this group, are healthcare providers. in various natures, right? I saw from that original poll, RNs, LCSWs, EMS, and a couple of others, but we're in healthcare. And there are additional laws around healthcare providers. And we'll really talk about that. So given your role at work, if a patient presented to you, right, it's your next shift, that's patient interfacing with an injury due to an intimate partner violence assault. Just think, you don't have to unmute and tell me or chat in, but you are welcome to if you'd like and feeling. How certain are you of what you would do and what you would need to report? So if a patient presents with an injury due to an intimate partner violence assault, right? How certain are you of what you would do, right? Do you have to report that? And who do you have to report that to? Do you know for sure? I'll give you a moment to just think. What do you do? What's your internal procedure, right? What if it's not an injury? What if someone discloses intimate partner violence or sexual violence to you, but it's not an injury that they're there getting treatment for? Then what do you do, right? Is there, I think oftentimes in departments, and this isn't something I'm discouraging or saying this is bad for your agency or office, but there's often like a go-to person who's an expert or knows this is the plan. Here's what we do. Here's who we call, right? Who's that person? Who's that person in your department, office, or clinic that you would talk to, or you would go to if there's someone who presents, right? Think about these pieces for a minute. And my plan for us in the next few slides is to be able to answer these questions if you're unsure of what and who you would report to in these cases, and you know, where you would turn. I want you to be able to more confidently answer those questions. I did promise we would look a little bit at Utah code for these things, and here is the one for healthcare providers. So it's called the Injury Reporting by Healthcare Provider, and it is the Utah code, and it is defined. And I want you to kind of see how it starts to be defined, and start thinking about what your role is and where you fit into this requirement, right? So this starts to outline the mandatory reporting for healthcare providers. So if you're a person, firm, corporation, association which furnishes treatment or care to persons who have suffered bodily injury, right? And that includes all of these places. I shall not read them all out because I am convinced everyone can read. But that's a lot of different offices and professionals here within this training and within this work. So all of these people fall into this category of mandatory reporters. Now, what are you mandatorily reporting? Guesses?
Hi, Claire. I actually have a question, because in the trauma world, everyone has bodily injury. So could you be a little more specific?
Yeah. So bodily injury, like a wound or other injury inflicted by a person's own act or an act of another by means of a knife, gun, pistol, explosive, infernal device, or deadly weapon, or by violation of any criminal statute of this state. That's what the code is actually. So bodily, this is the part of the code. So it's lawmaker lingo. The way we break it down: injury due to assault, right? So if there is an injury due to an assault, any wound or, injury inflicted by their own act or an act of another person, right, criminal act, that means this mandatory reporting falls into place. So when we kind of draw these lines with here's what this code says, and here's what criminal statutes are, and here's all these pieces, what it breaks down to is if a patient is being treated for an injury due to physical or sexual assault or has been threatened with a lethal weapon, the mandatory reporting law for healthcare providers is call police. The other part of that is if children were present during the assault, or if patient is a minor or vulnerable adult, we also must report to DCFS or that Adult Protective Services, right? That kind of goes back to we're all mandatory reporters for this, and if children are witnesses to intimate partner violence or domestic violence, that is a mandatory reporting piece for child abuse. It's considered child abuse in terms of Utah law as well. So that's something that all Utah adults have to follow. And they're saying, I'm here with a broken arm because my partner hit me. That's the reason, that is reportable. They're at a clinic and receiving treatment for a cold and let you know that they have been sexually assaulted by their partner in the past, but that's not why they are seeking treatment at that time. It's not mandatory reporting, right? So it's that, why are they being treated right now? So for the patient, why are they being treated at that time, right? Why did they present to you? What brought them to you? Then the caveat, of course, becomes, did children witness it? Are they a minor? And if they're a minor, then there's other pieces, we have to consider, which is DCFS are always going to be involved, or vulnerable adults. Adult Protective Services always have to be involved. So we're making those calls anyways. Why did they seek services, right? Why did they seek medical attention today? Any questions or clarifications on?
So Claire, there's a few things in the chat that we should point out, and a few questions. Patricia states that penetrating wounds are all reported, which is great. Someone asked, would burns be considered a penetrating wound? In our hospital world, no, but over here it does say an explosive or infernal device is reportable. Janet states, so we should assume guilty until proven innocent and report all weapon-related injuries when not known if it's self-inflicted. So we should assume guilty. So we should assume that we should report it if it's not known.
Good question, because there are elements of mandatory reporting that make it a Class B misdemeanor if healthcare providers intentionally or knowingly do not report bodily injury. Now, this bodily injury isn't just for intimate partner violence, right? You are reporting these injuries coming through your department. I'm only talking mandatory reporting for IPV. So what I just want to be clear on that. So you're having to report on a lot more than intimate partner violence. So yeah, if someone's coming in with a stab wound and it might not be IPV at all, then you still have to report under this code. I'm talking intimate partner violence. If you're following the law, right, you're not going to incur civil or criminal liability, right, for reporting suspected abuse or injuries, and you're not going to face discipline or harassment for making these reports, right? You're doing what you are expected and required to do. And HIPAA allows providers to make these disclosures of abuse, right? It's required by state law, and HIPAA knows that this is something that has to happen per state law. So that's fine within HIPAA code as well. So it's not a violation of HIPAA if that's ever a concern that comes up, or if someone brings that up of I can't call or I can't report because of HIPAA. That no, if state law says that a healthcare provider has to report this to law enforcement or DCFS or adult protective services, you have to follow the state law on that. You do want for intimate partner violence, though, right? It becomes tricky, different than the broader gamut of all the injuries that you see. I recognize that, yeah, you are handling a lot of injuries and accidents or not accidents that come into your departments and clinics. So I think the cautionary piece that I should have distinguished, and I want to clarify, right, is not for if it's all the bodily injuries. It's just for intimate partner violence, right? Because we want to be cautious and trauma informed and victim centered with people who are experiencing intimate partner violence, and empower those individuals to make decisions on if they're reporting their abuse to law enforcement or engaging those officials in their situations. Sometimes engaging those outside sort of entities is not what they want, right? And it might not be the chosen path for them. And in many, we want to allow for people to make their own decisions. But for me, with mandatory reporting, this is when it's to the point of when you have to report, when you are mandated to report, it is literally out of your control and out of your hands. So that's when you want to really think about it and ask, are they presenting to my office because of the injury? Is the injury that they're here for due to the intimate partner violence, or is the assault that they're here for due to that, or not? And if it's not, then it's not something you have to report. And if they are presenting due to the IPV or sexual violence, then it is something to report. As you've been working through these modules and sessions on primary prevention and thinking through intimate partner violence and sexual violence and in your workspaces, why wouldn't people who are experiencing IPV or sexual violence not want to report to law enforcement? Right? Why would they not want to engage in those places?
Someone, Charisse, commented fear of retaliation.
Yeah, thank you, Charisse. That's such a great point.
Abuse could be worse when they get home.
Yeah, absolutely. Thank you.
Patricia says the fear that the child will be removed or the children will be removed from the home.
Big time. Yeah, those are great examples, and I'm very happy that you brought those up and are recognizing them. Recognizing and understanding that there are these very real and valid reasons that people don't want you as healthcare providers to call the police because they've been hurt by their partner, right? This is not their fault. They've not done anything wrong because they've had to come to seek medical attention because they've been hurt, right? But they might be suffering more for it, right? And you're not doing anything wrong by having to call the police or having to call DCFS, right? You're following the law. They're seeking help, right? No, neither one of you are doing the wrong thing here. But it's important to understand their experience too, and and what is happening on their, you know, in their mind and on their end of things, and to understand that maybe they're, you know, why they might not be forthcoming with you on some details, or why they might hide some of those injuries, or not want to share all those details with you, or become angry with you, or might not want to engage in follow-up with medical providers if this is happening. And again, it doesn't mean.
Claire, somebody wrote in here also, there's shame and guilt, so they're shamed, so it's difficult to put yourself out there for that.
Yeah, absolutely. It's so important. So I'm so happy that you've brought these up and can recognize these. And then my ask, and as we go through this, is to kind of keep that with you and carry, you know, recognizing these, that the fear of retaliation, fear, you know, fear of, you know, shame, fear and shame of that, guilt, fear of losing your children, all of those pieces. When you're talking and working with victims of IPV related injuries, or working with clients, or when you're having to make a report, that you're kind of considering that. And when you're talking to them and making referrals and using language that is empathetic and supportive of them, because this is all a terrible situation, of course, and they do need a friend on their side, and practitioners can really be that space for them. And even if you have to make a report, you can do so in a way where you're still providing services to them, which we will talk about, where you're still providing services or opportunities for empowerment. So you're not taking away all of their choices, but still showing some methods of, here's where you can still take some control back of the situation. But we'll talk about it. So thank you for that input there. I really appreciate it. So when you have to make a report to law enforcement, so there's a bodily injury, right? It's for intimate partner violence. It's the result of an IPV assault. You've got to call the police. First, what you're going to do is determine the jurisdiction where the injury occurred. If you're unable to identify that, it's okay to report to your nearest law enforcement agency. You can call 911, or if you know the non-emergency number for your local jurisdiction, that's fine too. So contact the dispatch of law enforcement, and the code asks for a spoken communication, preference of telephone, right? This is what you're going to let them know, right? The report shall state the name and address of the injured person, if known, the injured person's whereabouts. So they might still be with you. They might have left, they might have gone home, so just let them know where you think they are. The character and extent of the person's injuries, and the name, address, and telephone number of the person making the report. So that's you. So give them your info. Additionally, you want to document for yourself as well, for your records. So what law enforcement agency, LE, law enforcement agency in Claire lingo. So what LE agency did you contact? What time and phone number did you call? Who did you speak with? What's the name of the officer or dispatch who you connected with? And did you get a case number that was assigned? There should always be a case number that was assigned for that. So try to get that information down as well for your record. Pretty straightforward there. And that would be the same process for any other mandatory reporting for law enforcement, right? For any other bodily injury, not just intimate partner violence cases. I think a good plan for, for agencies is to know what your local phone, the best phone number to call for your local jurisdiction is. That's often who you'll be contacting, so you have that easily and accessible for when to call. We will talk about this as well, but if you're working with a patient and can engage them in this process where they can call the police themselves too, right? Where can you think about how you would engage them in making the call and doing the report themselves, and how you would document that in your case notes as well, right? How can you safely document, and where do you document that sort of information? So you're hitting those requirements of, yes, we followed the law, but you're not over documenting either. So I want to just give a couple of samples of scenarios you might run into, and we'll kind of run it by you with a poll here as well. But you see a patient for a routine procedure or checkup, so not an injury, and they tell you they're experiencing various forms of intimate partner violence in their marriage, right? So a poll should come up here at some point. So if they just tell you they're experiencing intimate partner violence in their marriage, is this a mandatory reporting requirement? So yes to law enforcement, yes to DCFS, yes to APS, which is Adult Protective Services, or no requirement. Okay, so something yes to law enforcement, something to DCFS, something to APS, and something no requirement. Now in reality, so you don't at this time, you don't have a requirement to report. The key here is that experiencing, right? They're just telling you that they're experiencing intimate partner violence, right? They are not in your office for any form of injury, right? So if they were there for an injury, yes, you would be calling law enforcement. But since it's not for an injury and they just disclose, you have no requirement at this time to report. Now, what you would do for best practices of trauma-informed care and supporting your patient would be to offer resources and try to get them connected with domestic violence supportive services. But you wouldn't have to report at this time. Then they tell you that their child has witnessed the abuse. For a child witnessing abuse, the question that becomes, is that considered child abuse? And what do you do if there's child abuse? So the majority of you said yes to DCFS. Some said law enforcement. None of you said there's no requirement. And yeah, you're right. There definitely is a requirement to report. And while you would, the report needs to get to DCFS, you're not wrong if you would call law enforcement too, because law enforcement would end up getting that to DCFS. So that I will take both answers actually. So great job. So for this case, you wouldn't be actually reporting that your patient is experiencing intimate partner violence, or that they're in your department because of a injury, right? But that their child witnessed the domestic violence, because that is considered child abuse in Utah and has to be reported. So it can get a little tricky, right? And it's okay to have questions or to be like, what do I do here? You can reach out or talk to colleagues or coworkers to sort of talk about what the best thing to do in those situations are. Great job. A patient presents with a fractured ankle. Their partner is there too, and you're uncomfortable with them in the way they continue to answer questions for your patient. You ever had that? Someone partner is there and like talking for them. You insist the partner stays behind during the x-ray, so you finally separate them, and the patient then shares with you that their partner pushed them, and that's how they got injured. So is there a mandatory reporting requirement in this situation? Yes to law enforcement, yes to DCFS, yes to APS, and no requirement. Right, so the question is there an injury? Right, bodily injury. If there's an injury, yes. So yes, if there an injury, and who do you report to? Yeah, we're going to report this one to law enforcement because there's a bodily injury, and so you're reporting that. We're reporting that one because we know it's caused by someone else. So we're going to report that to law enforcement. Are there other, before we hop on to the reporting for mental health providers, other questions, or do you all have any questions on specifics for mandatory reporting? So another form of reporting that is a requirement in Utah not for all medical professionals or healthcare providers, but for mental health providers. So this is the therapist, and I know there were some LCSWs in this group. So this is for you all, and I imagine you're familiar with this ruling. But the duty to warn, or under Utah Judicial Code, the limitation of therapists' duty to warn. And this is actually really important, and I talk about it and want to bring it up because this law, or kind of the Tarasoff laws, as they're also referred to, has its foundation and really were started or created because of a intimate partner violence, or a dating partner related homicide in the 1960s in California. A young woman was murdered by a former brief dating partner who became jealous and stalked her and harassed her after they dated. He disclosed to his therapist, his psychiatrist, that he was wanted to hurt her, planning to kill her, and that this is overly simplifying it, but had a plan, had intentions to harm and to murder this person, and he ended up actually murdering her. And thus these laws kind of became into effect all across the country. Many states have different laws around this that say that therapists actually have to warn a potential victim if they have a client who is making threats of physical violence against a clearly identified person, right? So in Utah, our law says that a therapist does have a duty to warn. So that means it's to make reasonable efforts to communicate the threat to both the victim and law enforcement officer or agency if they have a patient who has communicated to the therapist that they're making threats to of physical violence against a person or a clearly identifiable or reasonably identifiable person, right? So there's this duty to warn if there's protective factors. So we're going from, here's just a response of, you have to inform law enforcement if there has been abuse that's already occurring or injuries that are occurring because of abuse, to now on this other side of, if there are serious threats of physical violence being made by someone, you have a duty to warn that potential victim and law enforcement that this could happen. Shifting again, and this is just for therapists or mental health providers, and here is how they are defined. And it's also, therapists would follow the child abuse and vulnerable adult protections as well. I know we are to the end of our time, so I will not jump into our next session, but we'll cover this in a couple of weeks. Is really looking more at best practices within your agencies of prevention strategies, and talking with patients and within your organization as well, kind of shifting that framework and kind of that whole kind of conversation from reaction to prevention. Does anyone have questions for me or other topics you would like to discuss with each other or bring up?
That was a great presentation, Claire. Thank you for all that information. It was quite a bit. This video will be recorded, and it is recorded, and we'll place it up on the YouTube channel for more people's review as needed.
Yes, I agree. Thank you so much. And like you talked about, we will be getting into, in 2 weeks, more discussion on your prevention strategies, and in our breakout groups, doing more practice, giving people scenarios and talking about how do you implement prevention into our normal reactionary treatment as healthcare providers. So thank you again for that. If you guys have any questions or concerns, again, please feel free to reach out to all of us. Chelsea is going to be sending out a mid-program survey to everybody just to kind of see how we're doing. Chelsea's gonna wave you there, so you'll get that from her. So please give us your feedback. We would love to see how effective this is. If you guys are learning what you would like to learn. And then again, as we want to continue this into the future, even any topics that maybe we haven't covered that we can get more in depth on in the next time. That's what we're looking for, is we've just skimmed the surface this round, and next round going a lot more in depth about topics that hopefully we can push more prevention into this. So we know it is 4 o'clock. So we will let everybody have the rest of your day back. Make sure that you've answered the polling question. Looks like everybody's done that. Everybody have a great afternoon. Thank you again, Claire. We appreciate that. And we'll see you again next week or in 2 weeks.
Thank you for having me. See you all later.